Good afternoon, everyone. I'm Dr. Sarah Mustafa from DentistChannel.Online. Welcome to today's webinar about introduction of laser dentistry in daily dental practice. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It is your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first-hand information on the technological advancements in the dental field. Now it's time to start the session about introduction of laser dentistry in daily dental practice. If you have any question about this topic, please feel free to ask it in the question and answer box, and we will answer each and every question at the end of the session. I will start by introducing today's session speaker, Dr. Danial Arshad. Dr. Arshad is a consultant dental surgeon practicing in Karachi, Pakistan. His main expertise is in restorative and laser dentistry. He graduated from Al-Tamash Institute of Dental Medicine in 2015. Now he's pursuing his MPhil in oral biology from Ziauddin University with a special focus on laser dentistry and has submitted his thesis as well. Currently, he is a senior dentist and laser dentistry specialist at Medident clinics and has attended numerous workshops and masterclass courses locally and internationally. He is also in charge of the internship program at Medident. Welcome, Dr. Danial. It's our pleasure to have you with us.
All right. Hello. Hi, yes?
Yes, doctor, you can start your session.
Perfect. Thank you. Good evening, everyone. Sarah's given a very wonderful introduction, so I really don't need to say much myself. The topic for today is introduction of laser dentistry in daily dental practice. So what we'll be going through is we'll be talking about the fundamentals of laser. We'll talk about laser physics. Moving on, we'll talk about laser biology, and then how we can use the laser in daily dental practice. We'll be discussing a few cases, and in the end, we'll have a question answer session for all the participants. Now, light. This is the main slide for all the slides to come. So light defines our universe. On the largest of scales, it's the ultimate speed limit of the universe. And on a human scale, sunlight is the primary source of energy for all life on Earth. Light is deeply embedded in the human psyche. In every culture and every religion, to be enlightened is to truly see and understand. What is light? Photons can be seen as communication between molecules. When you gaze on a star, it stimulates a biochemistry in your retina by photons that have spent millions of years transferring the void of space. Our knowledge of stars is built on the photons from outer space. In a similar way, photons from inner space can tell us what these molecules are doing inside, and we call that diagnosis. The light can directly change what's going on within the body, and we call that therapy. So in this age of molecular biology and medicine, light is an exceedingly powerful tool, and it's just beginning to be tapped. Now, these two images are just absolutely wonderful. So they tell you how small laser diode can be, and you can see that image as compared to a pinhead. And then you can see on the image on the right that you can see that this is a huge hadron collider where thermal fusions are being generated using extremely chip lasers, and then we've got extremely large lasers. Lasers we can see everywhere. We see them in barcode scanners in your grocery store. We see them in the laser pointers. We can even see them in the laser to measure that distance. Laser is used in medicine as well. So we use it, we've established that it's used as a scalpel. It's used for cosmetic reasons such as whitening. It's used for biostimulation. it's used for vision correction, and it's also used for tattoo removal. So these are just few examples of how commonly the laser component. So the image on the right is what we usually see, and we think when you listen to a word laser, this is what we think. But lasers are a very sophisticated equipment. They have optical resonators, they've got lenses, they've got an electric current, which then generates that laser. The fundamentals of the electromagnetic spectrum. So we very commonly know about X-rays, ultraviolet radiation, infrared radiation. Visible light is itself radiation as well. But this is not the radiation that harms us, but in fact is the radiation which our body receives information from. The difference between laser and it's not unidirectional, it's just scattered. Whereas laser is coherent, it's monochromatic, and it's unidirectional. So lasers they take light, they take inspiration from the sun. But in fact, lasers are very precise in their manner. The lasers can be classified into three types. There are gas lasers, there are liquid lasers, and there are solid state lasers. Diode laser is a special type of solid state lasers. When we talk about laser classification in terms of wavelength, we've got the ultraviolet radiation with lasers which are less than 400 nanometers in wavelength. The visible lasers, which are between 500 and 760 nanometer wavelength, and the infrared lasers, which are above 760 nanometers of laser. Now, this is a schematic diagram which will help our viewers understand different wavelengths. So just a basic idea, wavelength is what determines the power and the penetration of the wave of the laser. So we've got X-rays, we've got which are basically built in the ultraviolet, and hence they are used for diagnostic purposes. We've got the other lasers, we've got visible light lasers, we've got semiconductor lasers. You've very commonly heard of diode lasers, so they usually fall in between the visible light spectrum. You've heard ND-YAG and the erbium-YAG lasers, and they fall far above in the infrared ranges. Now, why lasers? Why do we trust lasers? Because they're very different from other things. We see when we use a scalpel, when we use a machine, when we use a handpiece, we know we can see the effect. But how do we judge and how do we trust a laser? We trust because we trust light since the beginning. When infants are just a few days old and have very bilirubin levels, we place them in their most fragile state under UV light. And why do we do this? We do it because we know that the UV light will have an effect on the cell metabolism and reduce the bilirubin levels and eliminate jaundice. We've trusted light to help us heal for a very long time. A brief mechanism of action of how low-level lasers work in the cells. So when the light hits the cell, it touches the mitochondria. This is the main area where the laser is working. So the mitochondria releases the cytochrome C oxidase system, and that releases reactive oxygen species, nitric oxide, and ATP. So we all remember ATP. We all remember that the mitochondria was the powerhouse of the cell. So laser in turn is actually targeting the powerhouse of the cell. And that powerhouse is generating more power in the terms of ATP. We move on to just the basics. So the ATP really makes the cell more efficient. It increases the proliferation, adhesion, migration, and makes cell work more efficiently. The low-level laser therapy, if I have to summarize, results in increased wound healing, results inflammation. So this is the low-level laser part. There's a high-level laser part, which we'll be talking in laser, which is used for cutting, which is used for other therapeutic purposes. Now, this is a diagrammatic representation taken from the Harvard Medical Center website. So this tells us that all of these lines that you see, these lines are basically there. They help us. They're basically helping us look at how deep the the laser is penetrating. So every wavelength has a different penetration. And from the image, you can see that the 600 to 650 and the 700 to 940, these ranges have the deepest penetration. Whereas as the wavelength goes higher, 940 and above, such as erbium yak, such as cutting, the higher diode lasers, such as carbon dioxide lasers, these are then used for cutting, and then you can see that the laser penetrates and then it starts to cut the tissue. Right. So the approximate absorption. So laser. So I'm sorry, this is just a lot of physics, but I'm just going to quickly skim through. So laser, when we talk about lower lasers, we're talking about more absorption, and we're talking about higher wavelength of lasers. We're talking about more cutting and more generation of heat. So this will help how laser and tissues interact. The optical properties of tissue affect both the diagnostic and therapeutic applications of light. Depending on the optical properties of the tissue, the light from the energy may have four different interactions. The laser can transmit through the tissues. The lasers can reflect through tissues, and we see that usually in hard tissues such as teeth and enamel. We have absorption of the laser, and then we have scattering. So these are the four interactions lasers can have with the tissues. Laser tissue interaction, we can also see it can cause photoablation, which is for higher wavelength. These lasers are used for cutting and used for ablative purposes. We have the photothermal effect, which is more again in high powered lasers. And then we've got the low power lasers, which have a more photochemical and a biostimulatory effect. Now I'm going to explain all these three effects to the audience. The photochemical effect or the photobiological effect is used for biostimulation. Now, this is what we call low-level laser therapy, photodynamic therapy, or therapy which is biostimulatory. So it helps the body heal. And there's a specific dose for it, and it's at specific doses for each application. The photochemical effect is when we use the laser to kill the bacteria or the viruses or any microbiological, as you can see on the images, which we will discuss later. So the chemical effect is used to disintegrate and killing the bacteria within seconds to minutes. And the photothermal effect is when we use the laser as a cutting machine. We can, as you can see on the image on the right, we use the laser for an operculectomy, which was usually done, requires scalpel, requires stitches, requires much more aggressiveness. But the laser, with its zones of carbonization, necrosis, and edema, hence causes reduced bleeding and is a much more efficient tool. Just to tell you that the laser, when you're cutting the laser, it is just used like a scalpel or any tool. It needs to be in contact with the tissues. For the biostimulatory, you can use it in non-contact mode, and you can also use it for contact mode. Just difference is that the depth of penetration of the laser and which site you want to work with the laser. Now we're going to discuss all these, how we use the laser in our daily dental practice, right? So we'll take case to case. So one of the most effective ways that the laser is used, it's used for gingival repigmentation. Right? Most gingival pigmentation is physiological, right? But we have three ways that we can result in the laser, and that is we can use the laser. So the depigmentation can be removed with a scalpel. It can be removed with chemical agents, and finally, the laser is used to remove the pigmented layer. But why we use laser? It's more faster, has more predictable results. It is less just like a slideshow which will help you how we use the laser in order to cause depigmentation. So we had a patient, gave him very limited local anesthesia, and we used the laser in contact mode. Now this is the 980 nanometer, which is a higher wavelength laser, and the higher wavelength laser was used to remove just the superficial layer. If you're talking histologically, we're just removing the superficial keratinized layer down to the basal layer, and we're not going in the connective tissue. And this helps the pigmented layer get removed. And when the healing's finally done, we see nice pink gingiva. Another patient who had a problem of gingivitis, and we used just one session of laser, and you can see in the bottom picture that all these pigmented layers have now been eliminated. Another image where a patient had drug-induced depigmentation, and we used the laser to remove these pigments. Again, one session of laser, and we can see that the gingiva, the epithelium is back, the keratinization is back, and we even see the orange peel appearing. So we're basically not damaging, we're not reducing the tissues, we're just removing this basal layer, and then the superficial layer, and the skin comes back. Another patient who had a problem of pigmentation during her orthodontics, and then we did 2 sessions of laser depigmentation. Again, this was used with a high power laser because we're physically removing the top layer, and then hence we can see the patient now has absolutely pink gums, and they very fast 20 procedure. The anesthesia is very minimal. Most doctors prefer doing it with topical. I usually prefer doing it with infiltrate, and then the patients usually don't need to take antibiotics, they don't need to take any painkillers, just topical gels, and they're absolutely fine. Moving on to another cosmetic thing that lasers are used for are laser teeth whitening. Now, we have a lot of dentists online, and commonly we know that laser whitening is considered one of the best. So one of the most commonest treatments with lasers in dental practices around the world is using the laser for teeth whitening. Now, why would one use a laser for teeth whitening? Because it's more efficient, the results are nicer, the results are more brighter, and the treatment time is much shorter. So when you're doing conventional whitening, the treatment time is usually an hour and a half to 2 hours. With the laser, treatment time can be as less as 15 minutes to 30 minutes, and you can achieve the same results or even better results than you would in a single session of normal conventional whitening. So I would always recommend to all the dentists out there that prefer laser whitening for your patients because it is much safer, has much less depth, and has better results. Another very amazing way that the laser can be used is for temporomandibular disorders. Temporomandibular disorders can be ranging from joint problems to muscular problems. And the laser is absolutely wonderful. It's a wonderful tool which helps our patients heal, which helps our patient go out of pain, and which helps our practice improve because patients now have a way of having a chronic problem treated. Now, lasers alone are not enough. We do use splints, we use periodontal splint, diagnosis, not periodontal splint, we use TMD splints or occlusal splints and night guards. Different, every problem has a different night guard, but we use the laser to regenerate all the joint problems that have occurred for acute and chronic pain that the patients are suffering from their muscles. So it's absolutely useful tool in making patients pain go away long term. It's a very good tool in making sure that the healing after the TMD episode gets better. Another very common procedure that lasers are used are crown lengthening. So if you see the image on the right, tooth was absolutely broken down. The soft tissue was not very healthy. So once the root canal and the post-in core was done, a diode laser was used to remove the superficial soft tissue. And as you can see, the soft tissue is much more pinker now. It's much more healthier now. And all of this procedure takes lesser time than conventional scalpel techniques would. So the image before this is when we use the low level laser for healing, right? And this is when we use the high level laser for cutting. So lasers are absolutely dynamic. We'll be talking about one other way that the lasers are used further down the presentation. Another absolutely wonderful way that the lasers can be used is gingivectomy. Now, patient presented with a fractured cusp on the image on the left side. You can see that the lower molar has a fractured cusp, and you can see that the gum has actually grown into the laser. Now, what does that laser do? the laser, basically, we use the laser to cut this tissue out. As you can see here, very minimal topical anesthesia was used, no infiltrate, no injections were given. The carbonization actually helps with the healing, and then subsequently, immediately, a filling was done. So all of this in one visit without the patient feeling any pain and having a higher success rate of your restoration. Another way that we use the laser, as you see, this patient wanted diastema closure with composite, but we had one option, we could just put a composite in this area. No. And would that have caused gum disease? Definitely yes. So what we did was we used the laser, created a new papilla, as you can see here, and took the papilla more apically. All without any stitches and other. So this at the same time has much longer, much longer results. Now, moving on, so another way laser can be used is photo-activated disinfection, or more commonly used as one of the things that this photo-activated disinfection done is it treats the tissue with photochemical effect. So the blue gel that you see is usually toluene chloride, or it is toluene blue, multiple different gels. But the function of this blue gel is it goes into the tissue spaces, and it can go into root canal spaces as well. But in this case, we're doing it for periodontal reasons. And then this gel goes and attaches to the cell membrane of the bacteria. Now, as soon as it attaches to the cell membrane of the bacteria, the bacteria becomes bacteriostatic. But that's not enough, because the new bacteria can come in. So what we use is, when we use the laser activates the gel, and the gel disintegrates the bacteria. And now the entire area is bactericidal. So we went from an area which is very rich in bacteria, where periodontal disease is occurring, and then we took the laser to first halt the bacteria and then eventually eliminate the bacteria. And what does this do? This actually helps the periodontium grow back. If your patients have mobility in their teeth, such as grade 1 and grade 2, you can actually reduce that and give more function to their gums and their teeth. So this is a wonderful tool that you can use to improve periodontal health for your patients. It can also be used for disinfection of the root canal, and can have a much higher success of your root canals. It will reduce the incidence of E. faecalis, which is the most common bacteria which causes endodontic failure. And this particular laser any laser that you use can help disinfect the canals, eliminate the bacteria, and have better root canal success. Now, this is another image which we show how we place the gel into the periodontal sulcus. Sorry. And then we use the laser to activate it. There've been all of the things that I've been discussing with you has a lot of research associated with it. You guys can check it online. This is just one example that I've attached here. Another image of low-level laser therapy used for gingival recession and periodontal disease, and how we eliminated mobility from this patient's teeth. Another way that lasers can be used is for peri-implantitis. Now, this is a case very close to my heart. This patient came in, an implant was placed, and once the implant was placed, after just 2 to 3 months, we saw that the peri-implant bone was reducing, and the implant was not stable and could not be loaded. So what did we do? A dentist suggested to the patient that she should have this removed and have this area grafted, and another implant placed after 2 to 3 months. But the patient did not want that. So we embarked on a journey. We did 4 laser sessions over 2 weeks, and we did photo-activated disinfection. And after just a month later, when we took this X-ray, we saw that the bone was growing in this area. And then later on, this tooth was restored with a crown, and the patient is still using this implant in a very healthy way. Another very common thing that lasers can be used, and a topic of very dear interest to me, is xerostomia or dry mouth. So patients who have dry mouth, we can use the laser to improve their salivary function. So we can use the laser to increase their saliva. We can use the laser to make their salivary glands more effective. Now, dry mouth can be for in patients with diabetes, with patients who have cancer and had radiotherapy, in patients who are suffering from COVID. So we see that a lot of who suffered from COVID resulted in dry mouth. So dry mouth is becoming one of a very major chronic problems that has no fixed or long-term treatment. So the lasers can be used, and we conducted a research here in Pakistan that actually resulted and had showed promising results, significant results in how the laser was used to improve saliva in patients who had xerostomia because of radiotherapy. So these are the points used. So there's 6 points over the parotid gland, 3 points over the submandibular gland, and 2 points over the sublingual gland. And laser is just shown so that the salivary glands in this area can be stimulated. Another image showing how we use this patient actually had a tracheostomy tube. You can and he was suffering from, had cancer previously, got radiotherapy and surgery, and had very severe xerostomia. And we used the laser to increase his saliva production. Another very interesting way that the low-level laser therapy can be used, and that is with the patients who are suffering from loss of taste. So again, cancer patients, patients suffering from other diseases, that results in them losing their taste. So now, when a patient comes to you, what do you give them? There are no medications that you can give for taste. So what we do is we stimulate the residuals, the cells and the salivary area, the nerves which receive all the taste, and we see very positive results in patients who are undergoing chemotherapy, patients who are undergoing radiotherapy, or have mucositis from other causes. We can use the laser to help them enhance their taste buds, and we've seen some really positive results. And these are things that they don't require any injections, any anesthesia, anything. It just requires a few minutes of laser therapy that you can very comfortably do in your dental practice. Lasers can be used for surgery for smaller lesions as well. So this patient presented with a pyogenic granuloma. We gave very limited infiltrate. As you can see in the second image, the granuloma was removed. This is immediately post-op. And then after 1 week, we see that there's just absolutely no sign of the lesion. So all of this that would ideally require a scalpel, would require stitches, would require maybe antibiotics. All we gave this patient was a topical chlorhexidine gel, and this entire procedure, this entire surgery took less than 3 minutes. So the best thing that the lasers can help dentists do in their practice is that it can save them time. It can enhance the results. So we're not asking you to use the laser and just forget about everything else. You will need the laser as an adjunct to your regular dentistry. So this is one aspect of dentistry which is not very commonly explored around the world. In the West, they're using lasers very commonly, but in our side of the world, we need to focus on how the lasers can help us improve patient care. Another patient that we used the laser for was this mucocele. So this patient was referred to us by the ENT department of a hospital. And the doctor there said that I will use a scalpel, take this mucocele out, give you stitches. And the patient said, I don't want any of that. So we were referred this patient to us. We saw it, and then we gave infiltrate. Once the infiltrate was given, the mucocele was removed. This again was done under less than 4 minutes. And then immediately after 2 to 3 days, we saw that the healing was already there. This lesion was sent for biopsy, and we found out that it was a mucocele. So this was just a overview of how the case was done, for the wound to heal faster. And one other area where biostimulation is used very commonly is that for after implants, for faster implant integration. It's used for post-surgical pain. It's used for post-surgical healing. It's used for gingivitis. So any dentistry that you do, laser can play a part in making it better and improving it. Another laser surgery that we use is for operculectomy. So, if a patient does not want their wisdom teeth extracted and they want a solution to their pericoronitis, so lasers can be used to remove the gum tissue and make this area more cleanable, more accessible, and also results in patients having less trauma because of surgery. It results in patient experiencing better post-op experience, and also helps patients become pain-free long-term. So again, case-to-case diagnosis is very important, but lasers can be used to remove this superficial gum, and that actually really helps patients avoid extraction in certain cases. So again, this procedure was not more than 10. Very limited local anesthesia. You don't need to give blocks to the patient, just limited topical and infiltrate, and then the tissue was removed. 1 to 2 days of post-op healing, and the patients don't even remember they had extra tissue around their wisdom teeth. Lasers can also be used for ulcers. So this patient had very severe major recurrent aphthous stomatitis on the palate, and this was extremely painful. We did a couple. Now, usually this takes around 14 days, 10 to 14 days to heal, but we did laser and we saw that at day number 7 that the tissues already started healing and the patient was already experiencing less pain. So every session of laser that the patient gets, so we did one session of laser every day. The low level laser therapy was done, not the high level one. And the low level laser therapy is not painful, but actually takes the pain away. So every time the patient would go home, she would experience much lesser pain in her ulcer. And subsequently, on day 7, she said that the pain was absolutely gone, and the healing that we took this picture is actually very self-explanatory. Implant osseointegration. So implant dentistry is on the rise. We're all very pro implant dentistry. And how can we benefit our patients? Implants, when they are placed inside, if you recall patients every week for just a 30 to 40 second session of laser, so the biostimulation with the low level laser therapy really helps patients and actually fastens the osteointegration. So a little bit of biology here. The osteoblasts around the bone, in the bone and around the implant actually integrate much faster onto the implant when laser therapy is performed. So hence, it is an absolutely wonderful tool for better tissue healing, for better implant integration, and for better long-term success for patients who are undergoing implant dentistry. So this is, again, another very good tool that you can use to improve long-term stability of implants, and can also be used for implant complications such as soft tissue management. We use the laser for exposing these implants. So conventionally, once the implant is placed, after 2 to 3 months, we have to cut with the scalpel and then expose the implant. The laser can be used to pinpoint, expose the implant, remove the cover screw, and place a healing cap, which again saves the patient from stitches, again saves the patient from tissue trauma, and is also much more effective and much less painful. One of the major things that lasers is also used for is diagnosis. So 405 nanometer, or the lower wavelength, is used for diagnosing precancerous lesions, for diagnosing caries, and for diagnosing cracks. This is an image of the tooth, and we can see that we don't see any caries, but when we use the laser, we saw that there was interdental caries. We saw that there was caries just below the enamel, and that was only possible using the 405 nanometer laser. We can use the laser for crack detection, and this is something that the lasers can help us. They can help us detect cracks very commonly. We can use this in our daily practices for cancer screening. So the low level laser can actually help us screen for cancers and can help us diagnose or unnoticeable lesions in patients, and can help them from their cancer getting in a worse stage. Lastly, lasers can be used in endodontic. It can be used to disinfect. So there are two ways of disinfecting the endodontic canal. We can use sodium hypochlorite and use the high level laser to activate. As you all know, sodium hypochlorite needs activation for it to be more effective. So the laser can be used to activate the laser when we use a high powered laser, or we can use the photo activated disinfection method, where we take the toluene chloride, place it into the canal, and then activate it using the laser. So what does this do? Lasers, the research has shown, can cause much more penetrate depth in the dentinal tubules, and actually results in much lower numbers of E. faecalis bacteria, which is the most notorious bacteria and causes endodontic failure. All right, thank you very much, guys. That brings us to the end of our presentation. I hope this was helpful. I hope it was audible. If you ever have any questions later on, feel free to reach out to me. These are my Insta handles, my email, and my Facebook. And if you guys have questions, please type them in the Q&A box on top, and then Sarah can then relay those questions to me, and I can answer if you have any queries. Thank you very much.
Thank you, Doctor, for sharing your knowledge and experience with us. So meanwhile, I will ask your permission to introduce our company to all the participants, and I request all the participants to kindly put their questions in the question and answer box. So this is our organization, DentistChannel.Online, Healthy Smiles, Wealthy Lives. DentistChannel.Online is India's first digital dental media company. We did more than 400 national and international webinars with speakers from all around the globe. We did many successful world implant expos. We gave more than 40K participation certificate, and from now on, DentistChannel.Online will be giving e-certificate with 1 CPD and CE point for each free webinar for Prime members only. So if you're not a Prime member yet, kindly join our family to get free certificate of participation after every event and get exclusive offers and discounts on our online and on-site paid workshops and courses. In order to benefit from a discount for Prime membership, you can use my promo code SAR100, so you can get it for $9 per year only. This is an example of the certificate of participation that you will get after every event. About our upcoming webinars, tonight at 7 p.m. Indian Standard Time, we have a session with Dr. Verma about infection control in dental clinics, and another session with Dr. Naval at 9 p.m. Indian Standard Time about hair transplant surgery. Dr. Noor will be giving a session on March 18 about medical emergencies in dentistry. I request all the participants to kindly save this number and then send a message on WhatsApp with their name, so they will be added to our broadcast list and they will receive everything about our upcoming dental webinars and courses. Today's webinar is sponsored by NovaMind. NovaMind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implant types called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. If you want to know more about NovaMind, kindly check their website. And finally, don't forget to follow us on our social media platforms, Facebook, Instagram, and YouTube. So now let me see if we have any question. Okay, doctor, so we have questions. Dr. Zainab is asking, can you please tell the brand you would recommend for laser?
All right, so this is a controversial topic, but you see, it depends on the use that you have. So if you have a low level, if you're more into biostimulation, if you're more into healing, so you need a brand which provides you with a lower wavelength. So there are a lot of companies that do that. I personally use the Lasertronics machine, which has all 3 wavelengths, and that's why I usually recommend that. But there are also multiple options that you have, and which supplier, which company is present in your country, in your city. I think that's the most important fact. So any company which all companies are the same, but depends on on which company is providing you wavelength. If you're into the surgical aspects, which has above the 900, or anyone which is above the 850 or 830 nanometer pulse mode. But if you are into the healing area, so then again, a company which is providing you in the visible spectrum is a very good option.
Okay, doctor, you have another question. What are the settings for low-level laser therapy and what is the duration?
Thank you for the question. The settings for the low level laser therapy depend on what you are treating it for. So we've got the science behind it is you have to have a certain seconds, or the depends on the minimum is 15 seconds of laser per spot. The other parameters that affect are what how much wavelength you are using. So we're using, if you're using the 600 wavelength, so how much power you're using. So low level laser usually has power under 500 to 1000 milliwatts, right? So that's the power that you're supposed to use. The second duration per spot tip is usually 15 to 30 seconds. The energy that you need to have per area or per session is usually 15 to 30 joules per centimeter square. So these are the settings that you need to put into the laser machine. The good thing about modern lasers are all of this is already fit into the laser. So you as a dentist don't have to really put in any settings. You just have to select what procedure you want to do, whether it's xerostomia, it's gingivitis, it's PAD, it's cutting. So everything, then automatically the machine uses all the physics behind it and then gives you the certain settings already. So most companies now come with the preset, so you don't have to worry. But usually if you're doing low level laser therapy, it should be below 500 milliwatts. It should be between 15 seconds per spot, 15 to 20 seconds per spot. And usually you should not exceed 30 joules per session.
Okay, doctor, thank you. We have another question. How many sessions of laser are required for TMJ disorders and how many for dry mouth?
All right, so TMJ, my protocol for TMJ is that we do usually 30 joules per session and 4 sessions for one session per week. So total of 4 sessions over 4 weeks, one session, and it's done bilaterally. So it needs to be done on the affected area. If it's the muscles, so all the muscles, the masseter, the temporalis, the median and the lateral pterygoid, intra and extra oral lasers according to each muscle should be done on both sides. So always remember, guys, that if the laser is in the certain area, it's biostimulatory, but too much laser will result in it becoming bioinhibitory. So you need to know that if you're doing it for the TMJ, 4 sessions, one session each week will help your patients recover. But at the same time, the cause of the TMD or the TMJ disorder needs to be diagnosed and corrected as well. And for dry mouth, the protocol that we used and we designed was, again, like I mentioned, we used 100 milliwatts. We used 33 joules per session. We used 6 points over the parotid, on 3 over the submandibular, 2 over the sublingual, and each point had 15 seconds. So each point laser that was done for 15 seconds.
Okay, another question. What are the complications? What complications can arise during or after the use of laser of higher wavelength?
All right, so one of the most common complications that we can have with using a higher wavelength is the fact that we can cause damage to the tissue. So it's just like using a gun. So if you shoot it at the wrong person or the wrong thing, so it is going to cause us damage. So just like that, the laser is a very powerful tool. It can be used for causing damage. So if you put in the laser on the cheek, for instance, you are going to make a hole in the cheek. If you put it on the lip, you're going to cut the lip. So the laser does not have any effect on the body. So if you're saying complications such as it cannot cause any cancerous lesions with using it in the daily dental practice, it cannot cause any irreversible damage to the dental hard tissues. But if it is hit in the wrong area, if it touches in the wrong area, it can definitely damage that area. So you need to be very precise with using the laser, which is why the laser tips, like I showed in my presentation, the laser tip needs to be in contact with where you're working. The low level laser, for this matter, does not have any side effects such as I mentioned for the higher wavelength.
Okay, doctor is asking, does the gingival depigmentation using laser help in growth of the epithelium?
Okay, yes, it does. So when we're not removing the entire epithelium, we're just removing it down till the basal layer. So we're not removing the removing. So we're not going very deep. We're just going in the superficial layer till the basal layer where the melanocytes are. So when we remove that, so we're actually relieving the potential for the epithelium to grow back. The difference between the laser and conventional method is that the laser also results in the cells being more active. So the cells heal faster. So it actually helps grow the epithelium back in much faster. But the epithelium does grow back, yes.
Okay, another doctor is asking, why is diode laser irradiation used in intervals with multiple doses?
So it is, so you see, just like I mentioned, so laser is biostimulatory to a certain effect. Mitochondria can take only a certain amount of energy at one time and then convert it into ATP. So if we give laser too much at the same time, the mitochondria gets confused and it stops working. So instead of the mitochondria producing more ATP, a lot of laser at the same time without giving it intervals will result in the mitochondria then becoming inhibited. And that's this, it's not going to cause any major damage to the cell, but it is going to be useless for the therapy that you're giving the patient. So if the mitochondria or the cells are not going to work effectively, then the laser is absolutely going to be useless. It's actually going to delay your healing purpose. So not to, we have to break it down into sessions so that the laser can be delivered, cells can take that energy and move in a better way and grow in a better way.
Okay, doctor, we have another question. What are the disadvantages or limitations of laser other than its cost, effectiveness, and why it's not used by majority of dentists?
Very nice. So the biggest disadvantage to lasers is cost effectiveness, right? So, but as we are getting more advanced, there are a lot of companies which are producing lasers at a much economical rate. So it's becoming economical. We see here in Karachi, we see that now government colleges and government institutions also buying them for the betterment of the common man. So what first is the limitation is price, yes, but you have options with cheaper lasers. But with the lasers, you just have to make sure you're using the right wavelength. And it is used by the majority of dentists in the West. So in the West, in the Middle East, in Europe, it is absolutely very common that every dental practice usually uses laser. But in our side of the world, I think the cost is the only factor and the lack of knowledge. So one of the reasons why I chose this topic is that we needed to make sure that people were more aware of laser use in the dental practice. People thought that lasers were used for a very limited treatments, but I hope we made that clear that the lasers can be used very commonly in almost every dental procedure we do. And when we realize that the cost, and when we spread the cost over all of our treatments, lasers are actually result in becoming very economical. So our patients appreciate it. They will appreciate you doing a laser disinfected endodontic procedure rather than doing a conventional one. They will appreciate you doing gum rejuvenation or laser depigmentation. So all of these, when they hear the word lasers in dermatology, are very excited about it. When we bring it into dentistry, patients have the same enthusiasm. We just need to, as dentists, as dental health providers, we just need to make sure we are well trained and have the knowledge of using the laser.
Okay, doctor, one last question. How many sessions of photoactivated disinfection are required to see results?
Very good. So basically, the guidelines generally are after each session of photoactivated disinfection, you wait for almost 1 week to 10 days, and then you reassess. Reassessment has the same physical criteria that periodontology does. You check in the attachment loss, you do probing, you check for bleeding on probing, you check for mobility. So all of the periodontal parameters we use before diagnosing the patient, we do them after. So if you're doing endodontics, using photoactivated disinfection just once is enough. If you're doing periodontology, you do it once, check your parameters. If they're getting better, you don't need to do it again. If you feel like no, the effect is not there, you do another session. So, and then you can see the improvement gradually. If your question was regarding how frequently you need to do it, so it is disease dependent. If the patient had periodontal disease, you treated it with photoactivated disinfection, and now the patient is coming back after 1 year for routine cleaning, you don't need to repeat the disinfection protocol until and unless the patient again has periodontal disease.
Okay, doctor, so that's it. Thank you so much for this informative session. Thank you for answering all those questions.
You're welcome. You're welcome. I would like to thank the platform for giving us an opportunity to present this little presentation. I would also like to thank all the people who took out time on a Sunday to listen to a physics lecture. But I hope that apart from the physics, this actually broadens your horizon and helps you understand that lasers can be very commonly used for the betterment of our patients.
Yes, thank you, doctor. It was a pleasure having you. Thank you, everyone, for joining us tonight. And we are looking forward to organizing more webinars with you in the future, inshallah.
Thank you, thank you, thank you,
Thank you.
inshallah. Thank you very much.
Have a good night, everyone.